Hi, my name's Amy. I'm one of the nurses that work on the postpartum floor. I'm going to talk to you today about safety tips. So, just so you know, all babies should be put back to sleep on their back, and this is an example of what it should look like. Nice firm mattress, no stuffed animals or anything around. You can use a lightweight cotton blanket to wrap the baby. You want to swaddle the baby underneath the arms and down. You don't want the blanket to become loose and cover the face because that increases the chance of SIDS. Or the other thing you can purchase is a sleep sack, such as this. Both will work totally fine. You want to keep the room around 70 degrees. The next thing I'm going to talk to you about is how to take the baby's temperature. So to take the baby's temperature, you just unwrap the baby, turn on the digital thermometer, put it underneath the arm, and hold the arm and the thermometer in place and wait till it beeps. You don't need to routinely take the baby's temperature, only if you feel like the baby is acting sick, not eating, or the baby feels cold or too hot. When to call the baby's pediatrician is when the baby's temperature is less than 97.6 or greater than 100.4. The next thing I want to talk to you about is cord care. We recommend just keeping it open to air and dry. Fold the diapers below the cord. Things you need to observe for is if the baby's cord looks red or has yellowish drainage, or if you touch the area around the cord and the baby cries, that could mean it is painful. So I would call the pediatrician and let them know that the baby's experiencing these symptoms. Another thing I would like to discuss is how to use the bulb syringe. Typically, the first couple of days, the babies can be a little spitty. They'll have bubbles in their mouth, or you'll just even notice some secretions. Sometimes you can wipe them out, but if you need to use the bulb syringe, you just push in, put it to the side of the mouth, let go, and that'll pull out the secretions. If the baby's still choking, sometimes you need to use the bulb syringe several times, pat them on their back, and stimulate them to get them to cry. So, and the final thing I'm going to talk to you about is burping the baby. So there's two ways I was going to discuss about burping the baby. So you can hold the baby up like this, support the head with your hand, and pat the baby on the back until the baby burps. It is good routine to always practice burping the baby after you feed the baby. Another way to burp the baby is you can sit in a chair, have the baby sitting in your lap, and then lean the baby forward and support the head using your hand underneath their chin, and just push them forward a little bit and pat them on their back until they burp. It is common for babies to experience gas pains. So if you notice that a baby is experiencing gas pains, some things that you can do are hold the baby upright, rock them, pat them on their back, or walk around the house. How you know if they're having gas pains is you'll notice that the baby has a high-pitched cry. They cry on and off. They bring up their legs and stretch their legs out, and they kind of act like they're in pain. So during this time, just kind of pat the baby on their back, and hopefully that will help. Thank you.